Good evening, everyone, and thank you for joining us tonight for the Illinois Bone and Joint Institute's 15th virtual YMCA Educational Series program with the North Suburban YMCA. My name is Kim Nyren, and I am the Director of Community Investment at the YMCA in Northbrook. We are recording this evening's presentation so that you can revisit it again and again. Please feel free to tell your friends and your family about it so that they too can view it on either the IBJI website or the NSYMCA. Tonight's program, entitled Understanding Physical and Occupational Therapy, will be hosted by physical therapist Julianne Rhodes, also known as Jules, and occupational therapist Zoe Goldhirsh. You have been told you need therapy, now what? The most common reason people see a physical or occupational therapist for care is to address pain or a potential injury that's inhibiting their ability to move and exercise normally. Physical therapists are health experts who improve quality of life through prescribed exercise, hands-on care, and patient education. Tonight, you will learn who can benefit and how it can help you. Julianne Rhodes, also known as Jewel, has been participating in physical therapy with IBJI since 2009. She has extensive experience in post-operative care of various shoulder, hip, and knee diagnosis, but enjoys treating a diverse caseload. Jules believes strongly in IBJI's collaborative care model and enjoys working closely with physicians and their staff to provide optimal patient-focused care. Jules is dual credentialed as an athletic trainer, ATC, and assists IBJI's ATCs with outreach coverage. Her ATC degree provides a solid foundation for treatment and prevention of sports injuries, and led her to become the leader of IBJI Sports Med Special Interest Group, also known as SIG, from 2011 to 2014. Jules and her team developed a performance-based ACL rehab protocol, return to play testing for all IBJI athletes, and a phase 4 program that has allowed athletes to have a structured path back to sports and activity. Zoe Goldhirsh is a graduate of Indiana University's Department of Occupational Therapy. Since the beginning of her schooling, she has been fascinated by upper extremity rehabilitation and has had a wonderful clinical experience within the field. Zoe is passionate about working closely with patients and doctors to optimize functional outcomes and satisfactions throughout the rehabilitation process. You will learn more about physical and occupational therapy from Jules and Zoe this evening. And as they go through this presentation, you might find that you have questions which we will be happy to address at the end of the program. When you have questions for the therapist, simply type them into the questions section on your screen. It should be on the right, and I will receive them and then relay them to them at the end of the program. I ask that you keep your questions general, as they will not be able to address individual concerns without individual consultation. If you submit a question, we will do our very best to answer it, but remember, if it is too personal, I may not be able to include it into the therapist's address. Please also understand that we receive many, many questions and may not be able to address all of them in the time allotted tonight. So thank you again for joining us this evening, and thank you for Julianne or Jules and Zoe for your time and effort in putting together this presentation to teach us all about something very important, understanding physical and occupational therapy. Now, please take it from here.
All right, good evening, everybody. I hope everyone's having a wonderful Wednesday in the middle of their week and enjoying the beautiful weather. So tonight we are going to take a look into what Jules and I do on a daily basis and what it's going to look like if you were to come to see us for physical or occupational therapy. So we will get into some of the topics that we're going to talk about today. So I'll just briefly overview some of our objectives. Today we're going to dive into what's the point of physical and occupational therapy? Why would I go, and why is it going to help me? So we'll talk about what it will look like to come to therapy on your first day, from your initial evaluation into detail of what some of your follow-up visits will look like, what the treatment looks like, and then kind of the therapist and your expectation about what's going to come out of this, and then discharge. So we will then address the often unknown difference between occupational and physical therapy in our setting specifically, and then why you would see a physical therapist versus an occupational therapist for certain diagnoses. Lastly, we will also briefly touch on the crazy world that we are living in today and how working in a pandemic and working from home has really changed a lot of people's setup and how that could really be affecting you physically. So at this point of the process, you are probably thinking about going to your doctor, or you have gone to your doctor about something that has been bothering you, pain, hurting, injury, anything of that sort, and your doctor responds with, well, you need therapy. And you're thinking, what is this going to look like? Why would this help me? I came to the doctor, what's therapy going to do for me? So we're going to really dive into the benefits of PT and OT in our setting and why it would be beneficial for you to come and see us as a therapist. So before I get into the nitty-gritty of what it looks like to really be in therapy, what is the point of it? So the goals and benefits of therapy generally include decreasing your pain in order to increase your function on a daily basis. So we often do this by targeting your strength, your range of motion, your flexibility, and improving upon those so that you can return to your prior level of function or activity or sport before you had injured yourself. Essentially, what we want to do as therapists when you come to see us is make you feel better. So we do see both post-operatively and conservative patients, meaning we will see you right after you've had surgery, and this is to help speed up your recovery, manage your pain, manage your symptoms, help with healing, improving your function and your independence. Additionally, we work on a lot of strengthening, which helps reduce your risk of re-injury or injury in general. And then other times we'll see patients conservatively. So they haven't had any surgery, they've just been having pain, and they're either trying to prevent surgery, avoid having surgery, or just prevent this from getting any worse. So we will treat and address things non-operatively as well.
So if you did see one of our IBJI physicians, you probably received one of these. So what this is a referral for physical or occupational therapy. As you can see, your patient name and info will be at the top, your diagnosis. Also, if you look to the right here, there is a box for PT or OT. So sometimes one or the other is checked, sometimes both are checked. So there is a lot of overlap in our outpatient setting between physical and occupational therapy. And so oftentimes our patients, the doctor will feel like PT or OT can treat either of those things. So what you'll look at here is the programs are listed that we have, and as well as some treatment recommendations that your doctor may feel is appropriate. Most of this information is really for your therapist. So if it doesn't seem like it makes sense, that's okay. That's for us to interpret. And this will be on file. So the nice thing about coming to one of our therapy locations is that we will already have this in our system. So you don't need to bring it along. When you call the front desk to schedule your appointment, they will already have this to pull into your file, and your therapist will be able to see this on the first day. Another nice feature of coming to one of our therapy locations after seeing the physicians is that we can access all of the doctor's notes and imaging from your visit. And it really allows for a collaborative care model and a smooth transition from your doctor visit to then the physical therapy visit. And then really us communicating back with the physician. So they will receive our notes, and oftentimes they're on site that we can chat with them about anything that we feel is appropriate that we want to do with you, and vice versa. So it really is a nice feature to come to one of our therapy locations after you see our physicians. In addition, just because you did not see one of our physicians, you can also come to any of our IBJI locations for PT or OT. We always accept outside referrals. This can even be from your primary care doctor. We are just because you didn't see one of our physicians, you can still come to our therapy location as well. So if you look to the back of your prescription, you will see that all of our sites are listed. So as you can see, we have several sites all over the Chicagoland area, and you can see what is convenient for you and just give the front desk a call. So you can call any of the locations listed and schedule an appointment for PT or OT. Oftentimes what they'll do is they will find out what your availability is and match you with a therapist that tends to work on that schedule. So if you need evening appointments or if you need, mornings before work, they can set you up with whatever therapist is working on that shift, and you will be all set for your first day. So if you look too on the back, it will tell you if PT and OT is offered at that location. And so that's available for you to call and schedule.
All right, so now we'll kind of get into what it's going to look like on your first day and what you should expect. So you'll come to an IBJI location on your first day and you will check in at the front desk. A patient service representative will then check you in after you provide your name and your information, and they'll explain and kind of go over all of your insurance benefits and coverages for the visits and what you're expected to cover and what your insurance is going to cover. They'll also provide you with paperwork, necessary paperwork that you're going to need to fill out so that we can obtain a comprehensive medical health history, which is really important to know before we start therapy and start treating you, to know if you have any important health history information that may be contraindicated towards some of the treatment that we may be doing. They'll also give you a functional assessment form to fill out, and this is going to ask you a variety of questions based on your functional ability, and they will target either your upper body or your lower body function based on what you've come in to see us for. And then you'll rate each functional task or activity on a scale based on how difficult it is for you to complete it. So either complete difficulty completing the task, or you have no difficulty at all. And this really helps give us a baseline level of your functional ability and gives us an idea about some of the specific daily tasks that you may be struggling with so that we can then address that in therapy. So sometimes coming to therapy, if it's your first time, can be a little intimidating. We put together some tips and tricks for your first day so that you feel really prepared and to just really make your first session go comfortably and smoothly. So like I talked about, a lot of that paperwork when you check in, we really recommend you arriving about 10 to 15 minutes early, so prior to your scheduled therapy session, so that it really gives you enough time to check in, ask all those questions you need to know about your insurance benefits, and then fill out all the paperwork that we give you. And this is important, I mentioned, just to give us a background of both your medical health history and your functional level before treating you. And then you want to make sure you have time to fill that out so that you really ensure having that one-on-one time with your therapist for your full session. Another important point that we like to bring in is to wear loose clothing or some kind of active or athletic wear. This really allows your therapist to access the body part in which you really are coming to see us for. It gives us a really good idea and a true idea of your movement and your limitations when we can really see your body. And then lastly, but definitely not least, come to therapy with an open mind. So like we're talking about, we are not here to intimidate you. We are here to listen to you. We're here to adjust things as needed. And ultimately, we're here to help you and benefit you. So it's really important to have that open mind and don't be afraid to ask questions throughout the process. Our goal is really to educate you as much as possible during this therapy process. So asking questions is a really great way to do so.
All right, so on your first day after you check in with the front desk, then you will meet your therapist. You will meet the scheduled therapist and they will perform the initial evaluation. And this is so important because our initial evaluation really drives the treatment plan. And every patient is different, every diagnosis is different. And this sit down kind of subjective interview is very important with how we direct your care. So even though we said interview, it's really not scary like a business interview. It's very casual. So we want to meet, who are you? What do you like to do? Do you like to go on walks? Do you like to walk your dog? Do you like to run marathons? So this is where we really get to know you and what is bringing you in. When does your shoulder hurt? Where does it hurt? What are the things that you're wanting to get back to? So even though you may be in pain and this feels silly because you already told the doctor all of this stuff, it's really important. And this is kind of my favorite part about the treatment session, because we get to know, the person behind the diagnosis and really treat the whole person. So it really helps us individualize your care and custom everything to fit the specific patient that's coming in. So the other thing that we will discuss, like Zoe said, any medical history. This is why sometimes it's a good time to write it down, because you may not remember your surgery dates or medication list. So this is all things that we will discuss on the first day during our interview portion. So after that's over, then we really get into the nuts and bolts of the evaluation. So here is where our therapy eval really differs from the physician evaluation. So while they're looking more at your imaging, your x-ray, your MRI, we're really looking at movement. So as movement specialists, we want to focus on how your faulty movements can contribute to pain and how we can correct those faulty movement patterns. So we will look at your range of motion, so how far your body part is moving through the range and the quality of that range of motion. So, not only how far can you move it, but how does it look like when you move it? Are you lifting your arm like this, or is it nice and smooth like this? So we will also look at strength measurements. We will use manual muscle testing and functional test measurements. These are also that we can get a baseline measurement because we are constantly reevaluating. So we will do progress notes, and so we can demonstrate progress to the doctors and your insurance companies, and also record if maybe things aren't improving. So the other thing that we look at is functional movement. So we look at your functional movement patterns. How do you walk? How do you squat? How do you reach behind your back? How do you move your hand and make a fist? All of these things are very important and give us a lot of information about what we need to work on and how we're going to guide our treatment plan. The last part of our evaluation is some therapists will conduct special tests. So this may be similar to some of the tests at the doctor's office. Some of these may elicit pain, and that's okay. We want to figure out when things hurt and how we can make it feel better. So sometimes these special tests help us to identify the specific structures, and that really gives us more information. So the whole purpose of this evaluation is for us to gain as much information as possible, and again, to give us kind of a baseline measurement.
So now that your initial evaluation and assessments are being completed, your therapist is really able to now identify your limitations and your impairments and what really needs to be improved upon in order to meet your goals. Goals are also another thing I want to talk about. So setting your goals up on the first day is really important, and communicating your goals to your therapist is really helpful and important in order to target the treatment specifically for your needs. So let's say it's really important for you to get back to golfing. You love golfing, but your pain or your injury is limiting you from performing that. Communicating that with your therapist will really allow them to create a plan of care that's tailored to you, and it's going to help you get back to golfing. And then a lot of what we do on the first day also includes patient education. So we'll educate you on how you can be modifying some of your activities, protecting your joints, and reducing your pain so that you can function better on a daily basis. Additionally, we will always set you up with a nice home exercise program before you leave on your first day. This home exercise program may consist of just a couple, stretches or strength exercises, kind of depending on your needs. And this will really get you started to carry over some of the stuff that you initially learn on your first day of therapy. So a common misconception of physical and occupational therapy is that all the work happens while you're here in the clinic. And that is just simply not true. We get to spend 1, 2, maybe 3 hours with you a week, and that's not going to fix you. And so a big portion of therapy is education, home programs, and carryover. So providing you with that proper education and instruction really allows you to carry over what we're doing in therapy to home in order to maintain and increase and improve your strength and your flexibility on a daily basis, so that you're not just feeling good when you come here, but you start feeling good all the time. So you can't expect us to just cure you. You've got to put in the work yourself too. And we work with you on that, and we educate you so that you feel confident and comfortable to be able to do that at home.
Okay, so after your initial evaluation, all of the hard work is done. So then you just get to come for your follow-up visits, and we focus mainly on treatment and making you feel better. So, some people will say, oh, I was more painful after the initial evaluation. Please come back, because every session won't be like that. So with the follow-up visits, they generally range from 45 to 60 minutes. And the focus will be on making you feel better. So Zoe's going to talk about that in a little bit, but generally 2 to 3 times per week, the therapist will work with you and discuss what treatment frequency is most appropriate. You will also see some of these providers listed here. So all of these providers are part of our team. And for your follow-up visits, you may see the physical therapist that you saw on the first day. You may see a physical therapy assistant, or if you're having occupational therapy, you will see an occupational therapist. We also work with certified athletic trainers and rehab technicians. So all of these people are part of our team, and they help us provide the best care possible. So it's really great when we see more than one provider, because it gives us an extra set of eyes and another set of skills. So I always recommend that my patients see more than just me. It just helps to bounce ideas off of. And also, if your therapist goes on vacation, you have already seen another therapist, or if they're sick, someone else is already familiar with your plan of care. So it allows for kind of that seamless transition. And we're always constantly communicating about your care. So even if you aren't with the same person, it's not a negative thing. We all work as a team, and we all share patients.
So now we will get into the more detailed idea of what it looks like during some of your follow-up visits and what that treatment really entails. The treatment is really the part that helps us, reach those goals that we've set on day one. So here are listed some of the different techniques and resources that we use throughout a session to really target your goals. A big thing that we do during our sessions are manual techniques. So this will include a lot of soft tissue mobilization, passive range of motion, stretching, joint mobilization, and all of these techniques are used in order to increase your flexibility and your range of motion and mobility in order to improve your exercise performance and ultimately improve your functional performance as well. Another set of tools that we'll use sometimes are modalities. So modalities include a variety of different things, heat modalities, cold modalities. So we could be using hot packs, cold packs, ultrasound, electrical stimulation. These are different modalities that we are all trained to use, and we can pull them into our treatment as we find them beneficial for you. So sometimes you'll see on your doctor's order, kind of how we touched on earlier with that prescription, you'll see that your doctor checks off certain modalities. And this doesn't always mean that they're going to be used during treatment, but it means they can be used. And then once you're evaluated, it's really up to your therapist's discretion to really better decide what's going to benefit you the most. Another thing that we use in a good portion of our sessions are exercises, therapeutic exercises and activities. So a good portion of your time is going to be spent learning, performing, and executing these exercises in the clinic. And they're going to target improving your strength, your movement pattern, your flexibility. And then oftentimes we'll use therapeutic activities in the clinic to allow us to mimic more of your daily activities and day-to-day life so that you can really start to see how this carries over on a more functional basis. Lastly, we will adjust your plan of care as necessary throughout. So just because we decide we're doing something on day one doesn't mean we're sticking through it if it's not working. We always are listening to you, working with you, and kind of adjusting to best fit you. So along with that, we will always modify, progress, adjust, upgrade the home program that we initially start you off with. And I'll emphasize again that these individualized home programs are really important to carry over with. So we do a good job at really making sure that you understand what you're doing. We'll give you pictures, descriptions, kind of frequency, how intensity of what you should be doing. And this really makes sure that you're able to continue that consistency of the exercises and carry over a lot of the education that we provide so that you really start to see the benefit of therapy. So at this point of the process, you've gone through numerous follow-up visits, you've been doing your home program for a while, you're starting to feel better, and maybe you've gotten to the point of discharge, which is our ultimate goal of therapy, is to kind of set you free on your own. We're not trying to keep you here forever. And so, you know, constantly educating on that home program throughout your treatments makes you really prepared for this discharge at the end. So you've probably met your goals. Your pain is a lot less, you're not having those same initial symptoms or limitations, and you've met your goals. So we want you to now carry over into that home program. So we make sure that you're set up nicely, that you have no questions, that you're really comfortable completing this, and then you're going to keep doing that to maintain your range of motion, your strength, your function. And it's really important too to kind of make sure you're at a low risk for re-injury or injury in general, because you're keeping everything nice and mobile and strong. So although we're going to set you free from us at this point in the process, you're not quite off the hook of taking care of yourself and your body. So the education that we provide you is something we really want you to carry over for a lifetime, and not necessarily just for the injury you're being seen.
Okay, so now that we've discussed the similarities and the overlap between physical therapy and occupational therapy, now we're going to talk about the differences. So with physical therapy, also most commonly referred to as PT, we are really movement experts. So we focus on the improving your ability to move, decreasing or managing pain, restoring function, and preventing future disability. So we really are focusing on quality of life and movement. We want to get you moving as quickly as possible and as pain-free as possible and for as long as possible. So we are really focused on movement, and we want to see you move correctly and without pain. So a lot of people, I think, have heard that physical therapy, PT, is pain and torture. That's not the case. So we're not here to hurt you. We don't like to see you in pain. Our goal is to get you out of pain. So it's not, I always tell my patients, it's not no pain, no gain. So if something hurts, don't keep doing it. That's not our focus or our goal with PT at all. We're really focusing on the opposite. So we want to move as much as we can with as minimal pain as possible in order to really help get you back to doing what you're doing. So we look specifically to highlight specific joint or muscle impairments in order to restore your range of motion and your movement patterns to get you back to golf or tennis or whatever it is that you like to do. We want to help you get there with not pain. So common diagnoses that we see in physical therapy ranges from anything to fractures to neck pain or arthritis. We see it all. So you know, PT and OT can have a variety of different meanings in different settings. Most specifically in outpatient orthopedics, it's easy distinction to just say from the shoulder down is OT and everything else is PT. But that's not always the case, but typically we're doing more of the other body parts. So this can be acute injuries from falls, this can be fractures, this can be chronic overuse injuries like meniscus tears or Achilles tendonitis, rotator cuff tendonitis, bursitis. We also do a lot of post-operative rehabilitation because we work so closely with our orthopedic surgeons. We do therapy after total knee replacements, total hip replacements, sports med injuries like ACL reconstructions and rotator cuff repairs, as well as shoulder and hip labral repairs, and also fracture fixation, so rods and screws after you've had fractures. We do the aftercare with that as well. Another thing that we work with are tendon repairs, so Achilles repairs, quad or patellar tendon repairs, anything like that, we are treating in physical therapy. We also have some specialty, so direct access is another option with physical therapy. So this is something that we showed you the referral earlier, but with physical therapy, you can actually schedule PT without a doctor's referral. So this is, of course, dependent on your insurance, but people can walk off of the street and you can go ahead and schedule physical therapy right away without seeing the physician. So it's really a great service because as PTs, we're musculoskeletal experts and we can evaluate and treat injuries and kind of bypass some time that you would spend seeing the doctor or going to the emergency room. That if we're able to get started with PT right away, we can get you out of pain. But of course, if the therapist that you see deems that PT is not appropriate, we can certainly have you see one of our physicians and get you scheduled with the right physician. So we can also talk to them and tell them about you and get you scheduled right away. So we could facilitate the appropriate referral with a physician if the PT doesn't seem to be working out with you. So specifically with the insurance that are not accepted for this, Medicare and some pre-cert policies, this won't work for, but most other policies, you can even call and check with your insurance to see if you could come without the prescription. So other PT specialties, we have certain locations that have therapists that have additional certifications in these areas. So vestibular rehabilitation, so if you've heard of vertigo or any dizziness or other balance disorders, also concussions kind of fall under this map. Also women's health, so any pelvic floor therapy or pregnancy or postpartum care, we have therapists that specialize with women's health. Also orthotics, where they're making casts of the feet and making removable inserts to go into the shoes. They get sent out to a lab and are custom fit for each patient. Also blood flow restriction training. So this is using a tourniquet to maximize your strength gains. And also dry needling. So dry needling is where sterile needles are placed into tight muscle points in order to have pain relief. So some of our locations have these specific specialties, and you can refer to our website to find out more information and the locations that these services are offered.
Now I will get into the world of occupational therapy. In the setting that we do work in, orthopedic outpatient setting, we're often referred to as hand therapists as well. So unlike physical therapy, occupational therapy or certified hand therapists focus specifically on the shoulder to the hand and everything in between. So we are upper extremity therapists. In OT, we specifically focus on addressing patients' limitations in order to improve their ability to perform their daily tasks. So their everyday, day-to-day tasks, washing your hair, brushing your teeth, getting dressed, all the way to, performing your leisure sports, your golf, everything. So we like to take a look at how you're moving and how you're functioning, and then we really apply that and tailor that into our treatment. We like to make our activities in the clinic very task-oriented and function-based so that you can really start to carry over what you're doing in the clinic and see how it can really impact you on a daily basis. So, as I mentioned, we are often referred to as hand therapists, and this is because in our specialized field, you are able to obtain a certification as a hand therapist. Because we're considered such a specialized area here in an outpatient rehab setting, you are able to sit for this exam only after you've had 3 practicing years in hand therapy or 4,000 hours of direct practice experience, whichever one you hit first. And then that allows you eligibility to sit for the comprehensive exam and become certified as a hand therapist. So when Kim introduced me and made a note that I would like to become one eventually, it is because I've only been working for 2 years, so I got 1 more year under my belt, and then I'll be able to sit for this exam. But it doesn't necessarily mean you can't treat as an occupational therapist the same kind of diagnoses. It's just kind of that extra level of certification once you've been in this specialized field. So some common diagnoses that we see in OT that may be different than some of the diagnoses they see in PT. They'll include anything from the shoulder, elbow, wrist, and hand, including different types of fractures, different types of arthritis. Most commonly, we see that CMC, thumb joint arthritis. We see a lot of lateral medial epicondylitis, often referred to as tennis elbow, golfer's elbow, carpal tunnel syndrome, Dupuytren's, trigger finger. So a lot of these hand-based diagnoses will come over to us as OTs. So another special thing that will set us apart from physical therapists in this setting is that we have a specialized skill set to fabricate custom orthoses. So orthoses in this sense would be for the shoulder, elbow, wrist, or hand. And they are used to support, immobilize, or protect the different body part that may be injured. A lot of physicians will tend to go towards these orthoses versus just casting you when you break a bone. This allows you to take it on and off for hygiene purposes, take it on and off for exercises, and really prevent things from getting too stiff. So we do see a lot of our physicians send people over right after they broke their wrist, and we'll put them in one of these and we'll fabricate them and custom make them so that the fit is as comfortable as possible. So some common orthoses or splints sometimes are they're referred to. I've listed out here. I'm sure the words mean kind of nothing to you, but they are different orthoses that are going to, address the finger, the wrist, the hand, the elbow, the forearm, different parts that are broken and different patterns that we are trained to form onto your arm. So in the next slide here, I have put a few pictures of some examples of some splints we've made in the clinic and some I have found online. So these are different splints. Some are wrists, some are for the hand, some are for the little finger you see here. And we have a couple different materials that we can make these splints out of. We've got thermoplastic, and then we've been doing a lot of functional casting as well, where you'll see that the splint actually mimics the look of a cast, but you can take it on and off. So we will basically decide based on the injury, the patient, the comfort level, and the need for the orthosis, what material we're going to use to mold. We'll also make these orthoses not just for stability or immobilization, but maybe in your treatment, we also make these as exercise splints. So we'll make dynamic or static progressive orthoses, and that will really target to help improve or support your function or improve your range of motion if you're real stiff. So this is something that's real specialized to occupational therapists in this setting.
Okay, so the last thing that we wanted to touch on was how we are doing therapy during the pandemic. So now that a lot of things have relaxed, we still wanted to, discuss how we're keeping everyone safe at IBJI. We just recently got rid of our temperature screening and the person screening at the door, but we're still taking necessary safety precautions here. We're sanitizing all of our equipment after anyone uses it. We wipe everything down. We're requiring everyone to still wear masks. And we are encouraging any employees or patients that feel ill to stay home. And also we still have the telehealth visits available. So this was really big when, cases were much higher, but we still have these to offer that if you're out of town or if you're not feeling so good, you can always do a telehealth visit from home. This has been a challenging year for all of us. And now that things are getting back to the new normal, we still want to make sure that we're staying as safe as possible. So the other thing that we wanted to discuss was, how are you working during the pandemic? So what does your workstation look like? Are you the person that hoarded toilet paper to make a laptop stand? Are you putting your laptop on your dog? So we've had a lot of patients come in for working from home in terrible workstation situations like these. So poor posture, really bad dining room chairs that are, working as desk chairs. So making sure you're taking breaks is really important. So don't lay down, don't, be in a really bad position, because it can affect neck pain, back pain, all of these things that we've seen as injuries. We just wanted to offer some tips of how you could manage this. So number one, you could schedule a PT or an OT visit where we could discuss proper ergonomics and treat you for your specific pain that you're having. But also just taking a look at your workstation. So again, taking frequent breaks every 30 minutes, stand up, try to walk around, go get a drink of water. Maybe even if you have the capability to switch to a standing desk, that is really great to take a break. But the most important thing is that you want to have a good lumbar support. You don't want to be slouching in your chair or sitting on a stool that doesn't have back support. So as you can see here in the left picture where he's sitting, nice office chair. And maybe you don't have an office chair in your work from home setup, but making sure that you have adequate lumbar support and good hip and knee position and arm position, supported arms, where if possible, your forearms or elbows can be supported. It really is important that if you're sitting at your desk for 8 hours a day and you have horrible posture, of course you're going to end up with low back or neck pain or shoulder pain or carpal tunnel, any of those things. Workstation is so important. So also taking a look at your monitor. Do you need to use a laptop stand? Or some of these adaptations can really help decrease some of your pain.
Okay, so we've kind of touched on all the points we really wanted to get across to you. So we put together some take-home messages that we really want to emphasize before leaving you, to kind of go right off of what Jules was saying about that workstation setup and the stuff that you're doing on that, big 8-hour chunk of your day. What you do on a daily basis, it affects your body. So when you're starting to have pain, take a look at what you're doing on that daily basis, or how you're sitting, or where you're working, because it really does affect your body. Another take-home message that we want to emphasize is how important home exercise programs are, how important they are to maintain and continue the results that you get from therapy, and also continue to improve and prevent further injury. Therapy, as we touched on, can be both rehabilitative from surgery or preventative. So, strengthening some weaker muscles that may make you a little bit more vulnerable to injury. And so strengthening those, targeting those, and preventing risk of re-injury or new injury is really our goal in therapy. And in the end, both physical therapy and occupational therapy can help you move better and live better. And that's our goal for you coming to therapy here. So we are going to wrap up now and kind of turn the table over to questions.
Hi. So I encourage all of you to go to your questions section and put some questions in that you have, but we did have a few that came in during your presentation. One of the questions that came up is, do all patients work with a physical therapist, or do you change them to a PTA? I have heard that it is better to work only with a PT because they are more knowledgeable and educated. Any thoughts on that?
So I can field that one. So that's not entirely true. So we do work with PTAs, and the only thing that PTAs cannot do is evaluation. So they have a lot of experience on the job. They see a lot of different patients, and we all share and communicate. So our two PTAs here are wonderful, and I've worked with several wonderful PTAs over my career that you know, sometimes have more experience than some of our newer graduate physical therapists. Not to say that anyone's better than the other, but I don't think that it is a negative to see a PTA. Like I said, I think it's great to share and have that extra set of eyes to see more than one person. So I don't think that that's a negative at all.
Okay, great. Another participant asked if our sessions always only a half hour.
I'll take that. So typically the sessions run between 45 minutes to 60 minutes. Rarely will you see someone for only 30 minutes unless you're kind of running late to your appointment. We do try to do at least 30 minutes hands-on with you, and then we try to get you moving and doing some of those exercises. So dependent on your needs and your injury, really depends on the duration of that. And that's something that after your first evaluation, you and your therapist can really, you know, decide, okay, yeah, I'm definitely going to be here for a solid 45 minutes, or I can expect to be here for an hour. And that's something we'll communicate with you, but it's something we don't really know until we see you the first day.
Okay, great. Another question is, how soon after a total knee replacement does physical therapy start, and how long does it last in terms of weeks?
So with our total knee joints, a lot of our patients now are starting therapy within the first 1 to 2 weeks after surgery. So the shift has kind of focused to getting people out of the hospital as soon as possible. And we're really, some people are even going home same day or the following day. So they found that long hospital stays and nursing home stays are not as helpful as coming to outpatient as soon as possible. So what we are doing with our IBJI physicians is starting the home health therapy right away as soon as they get home from the hospital, which could be in, you know, same day or the next 1 to 2 days, and then maybe seeing the home physical therapy for a week or two, and then really flowing into outpatient therapy as quickly as possible. So we really make the most gains in outpatient therapy. So as soon as someone is stable and able to come to outpatient therapy, that is when that's happening. I would say for total duration, it really depends. So, you know, because people are coming sooner, sometimes the total duration of their care is a little bit longer, but it can range anywhere from 6 to 12 weeks. So everyone's a little bit different, and it also depends on how stiff the knee is and the level of activity that patients want to get back to. So sometimes range of motion progresses really quickly. Sometimes it can be a little stiff, and then it does take longer that we're seeing people, you know, more from the 8 to 12 week range. So again, it really depends, but I would say that's kind of a safe range.
Okay, great. Thanks, Jules. I think this question is for Zoe. We have somebody participating here that says, what if you can't write or you can't fill out the forms? What are their options when it comes to that?
Yeah, so a lot of times if people are coming for their thumb or finger or wrist, and then you get handed, you know, a big packet of papers and they're like, fill it out, and you're like, I can't. A lot of times you can bring that paperwork back with your therapist if you guys want to discuss it together, and they can kind of help you fill it out. Most of the stuff we have you filling out is just circles. So, you know, if you're able to do it with your non-dominant hand, it doesn't have to look pretty. We just want to get a good idea of the important stuff down on paper. So, you know, if you don't fill out all that nitty gritty stuff, that's okay. If you do expect to have a lot of limitations with that, we do allow you to bring a family member or a close friend or someone like that that can come and help you fill out some of that paperwork as well. So those are all options, and we'll work with you. You know, if you're really limited, we'll make sure that we get the information that we need without making you struggle too much.
Great. I don't see any other questions coming in unless we want to wait a couple minutes. I do want to say thank you so much to Zoe and Jules. You guys were wonderful. And it's a beautiful night out tonight, so I want to thank the participants for actually logging in, because I know it's tough to do that when it's so nice out. I do want to let you know that the YMCA does have another presentation tomorrow at 12 p.m. It's Heal Your Heel Pain and Enjoy Life. And then we do have another June topic with IBJI on June 29th at 7 p.m. called the Outpatient Joint Replacement, presented by Jeffrey Goldstein. So we hope that you will join us as well. I want to thank everybody. I want to thank IBJI for being a part of the YES program at Y, and I hope everyone has a really wonderful night.